This video gives you an overview of peritoneal dialysis. It is not intended to teach you how to do peritoneal dialysis, but provide you with a picture of what peritoneal dialysis involves. You and possibly a caregiver will be trained on peritoneal dialysis procedures by the peritoneal dialysis team in your center. Darren does cycler peritoneal dialysis or automated peritoneal dialysis called APD while he sleeps 7 nights per week. Sometimes he will do ambulatory peritoneal dialysis or CAPD when he is traveling. The peritoneal dialysis machine may look different than the one at your center, as there are several machines available. However, the basics of setting up, connection, and disconnection are very similar.
I've been on dialysis for about 6 months, no more than 6 months, and it's been quite a learning experience. And to start the dialysis, I always take my vitals. Very important to take your vitals because it determines which bags to use. So I grab my table, take out my book, open the book to open page, and then you start filling it out. The date, solution, last bag. Well, you figure that out after you take your vitals. The first vital I take is your blood pressure. So you hook yourself up. Once it's done, you take your number and write it down in the book as you're sitting. Once that is done, you do your standing. Once that is done, you write it down as you're standing. Once that is done, you disconnect yourself. And because I'm a diabetic, I also check my blood sugar level and check my blood sugar. Write it down. Now there's one last, which is your weight. Once you get your weight, write it down. With all these vitals, you know which bag to use. You have the 2 bags, one for the top and one in the middle, depending on your vitals. Your last bag is your overnight, which is a 7.5. Grab that, you have your bags ready. And then now you grab one cassette for the cycler, and one drain bag. Have them on the bed. Then I sit. Spread out the drain bags on the bed. Put them side by side. Then you have these clamps. Always make sure that they're closed. You don't want them to drain in the middle of the night on the floor. And as a safety precaution, I always grab 2 more clamps and also clamp them. So there's 2 clamps. Once that's clamped, I grab the manifold. Once it's connected, fold them back up. And then put them on my bottom level and spread them out. First thing to do is take out your bag, look at it, make sure it's the right one. If it's the right one, tear it open. Have it out here, and I look at the date and the expiry date. If it's all good, spread it out, spread the end open and put it back. Same thing with the other bag. Make sure it's the right one, the right date, that it hasn't expired. Last bag, same thing, which is a 7.5. Open it up. The date is all right. Open it up, the end, and put it here. Now you turn on your machine. Press go to start. You press go and it says load the set. Well, then it's okay to open the cassette. And one thing I do before I even to connect it, I unwrap it. The 2 straps, one blue, one white. And at the same time, you have a variety of clamps. One on the drain line, you close it, close all the clamps. Grab the cassette with one hand and insert it. Once it's inserted, close it and put the rest on the clamp. Now you're ready. Press go again and it'll say self-testing. It's testing the lines. Connect bags. Open the clamps and connect bags. So you take the first one on your right, which is for your drain bag. Open the cap, take your cap from your two drain bags that you connected with the manifold, take the cap off, and connect them. Once that is connected, you take, I guess you'd call it your main bag, the red clamp. Open it, open the cap. Open the cap from the bag and connect them. Once it's connected, you break the seal. Once you break the seal, I always take the clamp and bring it forward till the end. That way I know personally that I did all the procedures right. Next one is your second bag. Again, take the cap off. Take the cap off the bag and connect them. Next bag is your blue cap. Take off the cap. Take off the cap to the bag. Connect them. Again, break the seal. Open your clamp. Your last one connects to you. You have it open. Hang it back up. Once it's all connected, you're ready. Press go. Machine primes everything. Everything's all right. It'll say connect to yourself. It's very important to make sure you have your clamps. It's if you follow the procedures, you won't forget, but there's times I have and I forgot to close the clamps and put the second clamp on, hooked everything up. In the middle of the night, I woke up with a puddle of the solution all over the floor. Had to close the clamps and reclamp everything and clean up. It's the procedures. Technically, if you do every procedure as in sequence, shouldn't happen, but there's times where it does happen. And you deal with it. And you also learn from it. There's a lot of stuff that I've learned through trial and error. When I'm disconnecting, I close all the clamps first. There's one for each bag. And from experience, I take my blue clamps, take two of them, and the drain bags. I always clamp it because there's always some in the lines. And you end of therapy, you press go. And it says close all clamps. Well, then it's okay to cut the lines. Hold everything in one hand. Grab your main line to you. Wrap it around. and then press go. It'll say disconnect yourself. So that enables you to open, take out the cassette, close it all with one hand, and you have it all with one hand. Then you grab the 2 bags that are empty. You have it. And I've bought a garbage can just for this. And then the next step is, I've been told, to check your drainage for clearness and signs of infection. So I've taken a paper and I've written on it. I put it on the floor and I take my drain bags, one at a time, put them over the paper. It's clear, so I know that there's no contamination, infection in you. Take the other bag. It's clear. So I grab the bags, take them to the bathroom, to the toilet, cut them and drain them and throw them in the garbage. And then I come back and I grab the bag on top and do the same thing. Drop the bags. And I also have a garbage can in the bathroom just for these bags. Flip it over. I always have 2 pairs of scissors, one in each room. Then grab one of the bags and at the same time take off the scissor clamps, and then I have it in the corner and I cut the corner. Once I cut it, drain it into the toilet. And the last procedure is taking the vitals of the machine, I guess. Grab a pen. They give you this at the clinic, and it's to keep record of your vitals and everything. And press, says turn me off. Then you'll be able to, your eye drain volume, which is 2508. So down here on it says ID, write down 2508. Your next one will be your UF, which is 675. It varies each time depending on your body. After that it's okay to turn off the machine. And with the twin bags, you have your pole. Once you have it up there, you warm up your bag for 2 minutes in the microwave, or they supply you with a warmer. Once it's warm, open your bag, take it out, check it's the right one, and the date. Everything's all good. Spread it apart and hang it. Spread everything apart. Take your hand disinfectant. Clean your hands. Once your hands are clean, take out your catheter. With one hand in your catheter, the other hand, take off your caps and connect.